Okay. Good afternoon, ladies and gentlemen. My name is育伟. I'm here today to talk about the epidemiology and outcomes of hospitalization of influenza in the cancer population in Taiwan. So in the beginning, let's think about it. Have you ever wondered what it would be like to assess the disease and the economic burden of hospitalization of influenza? You may ask me what's the importance, what the result may be. So this research will show some findings to us. Okay. Influenza is associated with high rates of morbidity and mortality worldwide, with the incidence of children and teenagers known to be the highest and the mortality being greatest among the elderly. Influenza is sometimes associated with malaise that persists for several weekends, which result in restriction of activity and accounts for millions of days lost from work each year. Influenza infections are more severe in patients with a significant comorbid condition such as cancer. Consequently, influenza infection carries with it both significant human and economic causes. Influenza vaccination can reduce the need for hospitalization from pneumonia and influenza, chronic disease, persons in high-risk groups. With increasing number of people in Taiwan affected by cancer, maintaining a high quality of life in this population will require close monitoring of routine preventive health care measures. The influenza vaccine is composed of antigens from the strains of influenza that are anticipated to be dominant in the coming year. So in Taiwan, the vaccine is recommended for all persons 65 years of age or older, particularly those who are at increased risk from underlying chronic immunosuppressive disease. But as we know, very few publications specifically address the importance of up-to-date immunization among patients with cancer in Taiwan. So what I'm going to show is that estimating the human and the financial impacts on patients with cancer who has been hospitalized with potentially preventable and serious influenza-related infection in Taiwan using a complete medical database for Taiwanese patient record from 1999 to 2005. For material methods, we obtained hospitalization data from the NHI research database covering the year from 1999 to 2005. The NHI here means the National Health Insurance Program and offers a comprehensive, unified, and universal health insurance to all citizens in Taiwan from March 1995. The NHI database contains every medical claim record, as you can see, inpatient care and outpatient care, including ID number, gender, birthday, date of visit, length of hospital stay, and ICD-9-CM diagnosis, the time trend from 1999 to 2005. Information about cancer, including the date of diagnosis, was obtained from the Cancer Registry of Taiwan. The data from this registry has passed rigorous quality assurance criteria, including 90% or greater in completeness estimate of case ascertainment. Sentinel surveillance. The Sentinel surveillance system has reported cases to the CDC in Taiwan on a weekly basis since 1990. Sentinel physicians report suspected cases among their ambulatory patients, such as the influenza-like illness. Isolation of influenza virus. Specimens were obtained by nasal wash with formal of saline solution. Influenza A and B were detected by using the Hexaplex assay. as the slide shows, we use many definitions in our research. A cancer discharge record was an ICD-9 diagnosis code indicating a malignancy. A chronic disease discharge record was an ICD-9 diagnosis code indicating a chronic disease. An influenza discharge record was the diagnosis code indicating influenza, bronchial pneumonia, or pneumonia caused by non-specific organism. The general population discharge record was defined as one without cancer or chronic disease diagnosis. We also estimate the number of hospitalizations that were likely to have been caused by influenza. Estimate the number of excess cases caused by influenza. We subtracting the expected number of cases based on April to September data from total cases during the influenza season, October to March. Length of hospital stays is based on the number of days that elapsed from admission to discharge from a single hospitalization. Ventilation is described as the proportion of discharge with any reported procedure. The cost, hospitalization cost, was calculated from reported discharge that were inflated to $2,005 by using the Taiwan Consumer Price Index for medical care. Statistical methods to ensure that our estimates of excess pneumonia cases were reflective of those reported through the Taiwan CDC's Sentinel surveillance system. We compare the total of influenza-like illness, medical visits, and the laboratory isolates with our study numbers using the Spearman test for correlation. So now I would like to show some results of our study. Take a look at this table. As you can see, this table shows the resource utilization and the inpatient outcomes stratified by disease feature. Compared to general population, cancer patient had more male gender and age 20 years old or older. Also in this table, compared to general population, both groups of cancer and chronic disease diagnosis had a higher percentage of mechanical ventilation and the single average hospitalization cost. This table shows the further analysis of resources utilization and the inpatient outcome, stratified by age group. Although the patient group aged less than 20 years old had an overall shorter hospital stay and a lower proportion of mechanical ventilation, but their average hospitalization costs were higher than those of the patient group aged from 20 to 64 years old. Okay. And this table shows the comparison of annual rates estimates of hospitalization among those with cancer diagnosis and the non-cancer diagnosis. Overall, patients with cancer had higher rates of hospitalization with an influenza-related infection than those with non-cancer diagnosis. Okay, take a look at this figure. The horizontal axis represented the time trend from 1999 to 2005. The vertical axis shows the number of cases. This graph illustrates the estimated number of cases in our study population. It's correlated with the number of influenza-like illness visits reported by the Sentinel physician, and even higher for the number of reported influenza laboratory isolates Conclusions. This study finds that patients with cancer that were hospitalized with influenza-related infection are substantial disease and economic burden in Taiwan. Vaccination of persons with malignant disease and their contact with inactive influenza vaccines could reduce the burdensome social impacts on Taiwan. So I hope you will all agree that we must make more modification on the healthy policy of influenza vaccination. So I would like to thank you for listening. Thank you.